Sandra, this must be the happiest moment of your life. You are a new mum, said my best friend, as I tried to tell her how sad I was feeling, my low mood, my anxiety, my depression. Sandra, why are you crying now? This is a happy moment. You should be blessed, said my very Nigerian mum in her very Nigerian accent, as I tried to explain to her that I was just traumatized after giving birth to my baby, Zoe. I didn't feel myself. I was angry. I was hurt. I couldn't leave the house. No one would believe me. I quickly Googled my symptoms and realized I was struggling with postnatal depression. And everywhere I looked, seek professional help, see a doctor, see a GP, speak to your midwife, your health visitor. How could I possibly speak to the healthcare professional when I didn't trust them? How could I speak to a system that didn't have my best interest at heart? How could I speak to people that treated me differently based on the color of my skin? Where these disparities stripped me of my basic human rights. We're 43% more likely to struggle with miscarriage, more likely to have a traumatic birth, more likely to have a stillborn baby or our baby dying neonatally, more likely to have postnatal depression, but the least likely to access support or have follow-up treatment. 4 times more likely to have complications and die as a result of our pregnancy, and the least likely to have pain relief. For those of you that have heard me speak before, I always make sure that I list out these disparities, just to reiterate that my experience is not a standalone event, that it often happens. But what did I do at that time? I suffered in silence. I kept it to myself. I couldn't share family or friends, and I definitely did not want to speak to a healthcare professional. Eventually, I started speaking and reaching out to different women, Black mothers, and I found that this was an ongoing situation where we were struggling in silence, being hurt by the system, and had nowhere to turn. Our community didn't really believe us, and healthcare professionals at the time we didn't trust. So I launched the Motherhood Group in 2016, a social enterprise that supports the Black maternal experience. And I made sure that I used my voice, my very loud mouth, to make sure that Black women, Black mothers are listened to, believed, and understood, and that our voice matters, and that our voice is amplified anywhere that I could get a chance. So here are a few of my hats. I'm an author. I'm also a patient and public voice partner for NHS Mental Health. I'm also a family voice group partner for Baby Lifeline, as well as a trustee for Birthrights, as well as other roles to, again, make sure that our voices are heard. A charity called Baby Lifeline conducted a report and found out that only 32% of UK maternity services provided training in cultural competency. 32%. There is clearly a lack of training around inequality for ethnic minority women like myself. 98% of Black mothers said that they were willing to access treatment or support, but only 32% hadn't received any, and 20% hadn't even spoken to their GP. Clearly, there needs to be more of a conversation around why Black mothers are not speaking up, are not getting the support that we so rightfully are entitled to. My organisation, the Motherhood Group, was commissioned last year by NHS England and Improvement to conduct and investigate why Black and ethnic minority mothers were not accessing perinatal support. And we produced some recommendations and solutions for us to get the support that we so rightfully need. We looked at a few themes: overcoming barriers, accessing adequate care, race and the impacts of culture, language and inclusivity, as well as co-production, community, and addressing these inequalities, education and awareness. When speaking to mums through our workshops and our engagement projects, we found out that so many mums wanted to speak out, but felt that the service just wasn't right for them, that if they came forward, that they would be punished. In the past, our trauma, our mental health struggles, our inequalities have been used against us. But also mothers said that they would prefer to have more of a personalized approach. So lots of mothers came forward saying that they felt like their appointments were very much tick boxed, come in like a conveyor belt and leave without having a personalized approach, not really calling them by their first name, not even looking in their eyes. Simple body language that can change an entire mother's experience, they weren't receiving. A lot of mothers also said that when they actually encountered microaggressions, yes, racism, subtle or covert acts of stereotyping, they didn't know where to go, who to talk to. There wasn't a clear or a smooth way of complaining. I myself have understood that. I also try to complain. Again, I use my loud mouth and my strong fingers to type up lots of emails and letters. And I just struggled to find, how could I get the support? How could I escalate this? I have been treated wrongly. Why is nobody listening to me? Again, the impact of race and racism. And in the UK, unfortunately, the way that racism is not very much in your face, it's not overt, it's very subtle, it's very insidious, and it's also very hard to explain or express. So mothers didn't really know how to navigate their way through the maternity system. So again, suffered in silence. 3 years ago, out of frustration, again, with the maternity system, Motherhood Group launched Black Maternal Mental Health Week, an awareness week that highlights disparities and raises some of the challenges and the issues that we as ethnic minorities face in trying to navigate our way through the maternity system. And this year, our theme was inequalities and equity. We looked at the role of stigma, community, culture, but also how we can kind of work together so that our voices again can be amplified. One mother shared her experience, and quite a few did also on social media. A mother said, I remember during one of my visits when I was giving birth, my son I was finally asked about how I was feeling. I immediately broke down in tears before I could answer the question. The look of shock and uncomfortableness on my health visitor's face made me feel as though my reaction wasn't normal. And she only clearly prepared to help me through it. From that day onwards, I've bottled everything up, how I've truly been feeling in my motherhood experience. I'm getting emotional remembering at that moment. The foundation of a child's health and mental well-being is based on the parents. Something really needs to change. Now on to the inquiry. Birthrights Charity launched an inquiry last year called Systemic Racism, Not Broken Bodies. Systemic racism, not broken bodies. I repeat that again because far too long we've been told that the issue is within Black and brown bodies, that we are the issues, that by default our bodies are so flawed and that's why all of these inequalities exist. No, that's not the right answer. The answer is that the system in itself is broken, and that's why these inequalities exist. And it was based on the 2018 Embrace report, where 5 times more a campaign was launched around us being more likely to have complications. But as you guys know, systemic racism in maternity care is a human rights issue. Every mother should be entitled to basic human rights. The right to dignity, the right to autonomy, the right to equality, the right to choice, the right to respectful care, something that I believe I did not have access to. And so we interviewed over 300 plus people, and we released a national poll which had over 1,000 responses. I also went over every news channel that I could possibly find to speak about my personal lived experience, as well as echoing the other mothers that have also taken part in the inquiry. We had 11 focus groups, as well as speaking to healthcare professionals who also reiterated that within the system, they're also struggling with biases and racism as well. That does also impact their mental health. And out of the inquiry, we spoke to decision makers, but we had themes across all evidence, 5. Many mothers reported that they just did not feel safe. Upon entering the maternity care, they just felt like healthcare professionals didn't have their best interest at heart. They felt dehumanized, spoken to with a lack of empathy, spoken to like they were just beings, not having that personalized approach. Being ignored, not believed, something that I can absolutely relate to. I am in pain, please, can I have pain relief? I screamed, I shouted. I didn't get any pain relief. It's only until recently I found out that Black women are the least likely to receive pain relief. One mother even said that a healthcare professional said her skin as a Black woman was tougher and stronger so she could handle the pain. I know my face did that as well, but I'm not surprised because, again, something that I also can relate to, because when I asked for pain relief, I was told there was a queue and the queue never decreased and I never received pain relief. When I cried and screamed, I was told I'm exaggerating my pain. Many birthing people and mothers within the inquiry also believed that they didn't really have access to consent, choice, or they felt like they were coerced into taking part in certain medical interventions. Again, I can also relate to that. I was induced without even knowing. I know it sounds again crazy, but seriously, I was induced without even knowing until a few months later, I realized that what the nurse conducted on me was a membrane sweep. She didn't explain to me, she didn't tell me. I just believed that what she was doing was normal. Racism by caregivers. Being told you're just being angry. That word in itself is very, very triggering as a Black woman. Being told you're angry, you know, stop shouting, you're being too loud. And having that passive aggressive tone. Lots of mothers, again, reported feeling like if they speak up, they're being seen as the angry Black woman. So many actually kept quiet, again, stripping them of their basic human rights. Structural barriers within the workforce as well. So how does racial discrimination show up in maternity care? Examples: being ignored, disbelief, racist stereotypes and assumptions and microaggressions, dehumanization and denial of pain relief. During my birthing experience and the way that I was treated left me feeling extremely traumatized. But after my experience, I did notice that once the nurse asked me, what do I do for a living? And I explained to her, her face became quite shocked. Her body language changed. She started speaking to me much nicely and much calmly and much more. Her entire tone changed. She gave me my own private room, tea, coffee. And then I realized, oh, she just assumed probably that I was a single Black mother, fairly young looking, and that I didn't necessarily need that, you know, basic human rights. I didn't need to be treated with kindness, respect, or dignity. But she was wrong. Everybody deserves to have these basic human right principles, especially during a time when you're vulnerable in pregnancy. Education and training. White bodies as the default or the norm, failure to recognize conditions such as jaundice or sepsis. A mother also reported that her child's symptoms wasn't picked up, again, not being able to recognize conditions in darker skin tones as well. I can't speak too much about my situation because my case is, again, ongoing, 4.5 years on. But when I raised concerns to my health visitor, they were ignored, they were disbelieved, and I was told that I was just being over worried. But my daughter's condition, again, wasn't picked up, I believe, because of the color of her skin, because she was a Black child. And again, treating white bodies as the norm is inherently racist. I cannot stress that enough. We need to have more of a personalized approach and look at everybody as individual beings. Policies and frameworks, ethnicity as a ground for induction with policies such as high risk. Again, we are not the problem. Our bodies are not broken, the system is. So using induction for everybody, Black or brown, again, is inherently racist. That shouldn't be the approach that we should take. We should look at first dismantling institutionalized racism, and then that's the first step, I believe, in tackling inequalities. NHS charging regimen and also failure to provide interpreting services. Lots of mothers were actually reporting that when they would come into the hospital with their concerns, before they were even seen, they were asked if they could afford, if they were, immigrants. Black British women like myself who were born here in the UK were also asked to see proof of their stay in the UK. It also shows up in the workforce, so lack of senior representation. Sandra, we see so many Black midwives, I often get told. Okay, but who are we seeing in places that actually have the power? I don't see much Black women or Black people or brown people there at all. Higher rates of disciplinary action and bullying and a toxic blame of culture as well. Calls to action. So all of this trauma after trauma, what do we do next? Commit to being an anti-racist organization. Sandra, I'm not racist. I don't want to go into the rest of the sentence. I often hear that as well, but we have to admit, we all have biases. We all have some form of misconception or preconceptions. None of us are, free from that. But we have to do the internal work to look at, okay, if I treat this mother this way, how am I treating her differently to the norm? Who am I prioritizing? Why am I getting extremely frustrated at this mother and not that mother? We need to decolonize maternity curriculum and guidance. Again, not using the white man's body as the norm. Make Black and brown women and birthing people decision makers in their care and in the wider maternity system. I'm really glad that at least now we're moving forward to allowing people with lived experience to share and tell our own stories, bringing us and making our voices amplified, and also centering us in our care. Otherwise, what good is it people telling us what we should be doing with our bodies when it doesn't affect them, only us? Create safe, inclusive workforce cultures. Most of my Black sisters, my friends who were nurses, they all want to leave the NHS. They are tired because they too are on the receiving end of all of these harmful preconceptions. Dismantle structural barriers to racial equity through national policy change. We're getting there slowly, but again, it won't happen overnight. Thank you guys so much for listening to me speak. If you'd like to know more about my experiences, you can look at ordering my book, My Black Motherhood. Thank you.